positions that we can get our patients into for to relieve pressure sores and stuff like that. So I would check the patient's chart before I go in the room and just make sure there's nothing that I need to be aware of before repositioning them. And I would knock on the door and do hand hygiene. Oh my gosh, do hand hygiene. Hi, my name is Jamie. I'm going to be your nurse today. We're just going to reposition you a little bit. Can you tell me your name and date of birth, please?
Alexi Hagen-Decker, 11/21/86.
All right, now I'm going to check her band and just verify the information. And do you have any pain today?
Nope.
All right. If they have any pain, you can give them some pain medicine. All right, this first position is called supine, and it's where she's laying on her back. And we just want to watch for pressure sores. So if you start seeing the skin break down at all, you can put a pillow underneath of their arm, like this. And also another spot to watch is their heels. So, sorry, I'll take this from you. You just want to put this under their calves and make sure that their heels are off the bed. You also want to make sure that their knees aren't, hyperextended. And the next position we're going to get her in is the semi-Fowlers. So we are going to raise the bed up, the head of the bed. We want the head of the bed at 30 to 45 degrees, and you also want to watch the degree and make sure that you're getting in the right spot and not just guessing. Is that comfortable for you, Lexi? Yeah. All right, that's about 35 degrees. And also, oh, your legs are pretty high, huh? And also the same pressure spots. We're just looking for the shoulders maybe, or the elbows, the knees, maybe her bottom. So the next position we're going to do is the Fowlers, which is 45 to 60 degrees. And I think this bed only goes up to about 60, so we're just going to stop at 50. And this is the Fowler's position. Same things, we're just looking for different spots where her skin can break down and just trying to prevent that. All right. Going back down, I'm going to show you the lateral position, which is on the side, and you can either put them on their left side or right side, just depends on their preference. When you're repositioning, you also want to make sure that the bed is at the right height for you to be working in, because you don't want to hurt your back or anything. Right. Oh, actually, I'm going to go on the other side of you. All right, and if your patient cannot move by themselves, you want to get somebody to come in here and help you, and you can use the draw sheet to manipulate them like to whichever side they need to be on, because right now it looks like if I'm going to lay her on her left side, she's going to need to just scooch her butt over a little bit for me, if you don't mind. And then, yep, she already rolled over on the left side for me here. And then let me just reposition these pillows for you. We want to put a pillow between the knees here and just have her leg up a little bit higher than her other leg, and also the arms, if she wants a pillow between her arms maybe. Is that comfortable for you, Lexi? Mm-hmm. And then we can also put a pillow behind their back. And also, before I did that, I would probably put this rail down so that I'm not reaching over her so bad and bending over. So the next position that we're going to do is the prone position, which is laying all the way, actually, no, I'm going to do the Sims position first. And that's where she's almost all the way rolled over, but not quite. So if you could just roll your hips for me just a little bit. There we go. And just put that left arm behind you. Okay. And then again, we're just looking for points where she might be sore. We might need to get this leg up a little bit higher here so that her toes aren't touching the bed, or whichever way is going to make her comfortable. And we want to just make sure that they're not getting bed sores. All right, now I'm just going to slide this. Actually, for the prone position, I'm just going to take this pillow out from underneath of your leg a little bit here. Sorry, Lexi. For the prone position, you can put a pillow underneath of their hips, like on their abdomen, if it's going to make them more comfortable. Some people don't mind just laying flat. And then, do you mind laying flat, or do you want me to put the pillow under your hips?
Flat.
Okay, if you just put your other arm down here for me. That doesn't look very comfy, guys. You can leave your arm up if you need to. Whichever position is comfortable for them. You know, you just want them all the way over on their stomach so they're relieving that pressure from the sores in the position they were in before this. All right, and I think she's going to stay in this position. Are you okay in this position, Lexi?
Yeah, this is great.
All right. We're just going to cover her back up. Is there anything else that I can get for you? Put your elbow for me there.
Nope.
All right. Oh, gosh. I'm going to put the bed rail up, and then I'm going to lower the bed back into the, oops. Maybe. I'm going to lower the bed back down all the way, and I'm going to give her her call light and just make sure that she's comfortable and she doesn't need anything else.